Hello and welcome to the WIHS Journal, Public Affairs from 104.9 FM. I'm Paul Kretschmer. This theme for today, once again, is February's Heart Month. Why does the dentist care? Dr. Tyler Williams will explain the importance of dental insurance for those who do not currently have it.
Yeah, absolutely. So, we're seeing more offices offer in-house plans. So we offer membership plans in my own office for our patients without insurance so that people can get the care they need and not feel like because they don't have insurance, they can't go to the dentist. And, much like, if we didn't have medical insurance, we would still know eating right and exercising are important. This is a good way for our patients to have access to care and education, and especially preventative services, because the CDC found that for every $1 spent in preventative dental care, we would save up to $36 later. So that's a pretty significant savings. And I also really think the high deductible plans can help a lot of our dental patients because more employers are opting for health savings accounts or flex spending accounts. And I think those are great in a lot of aspects because, if someone has minimal medical expenses one year, but maybe they need more vision care or more dental care, they can use those benefits where they need them the most. And it also makes us smarter as consumers because we're more informed about the care we receive when we're paying with it with our benefits. So I see that as in the long run, I see it as a big plus for preventative dental care, which will in turn save our patients and make them healthy, especially during American Heart Health Month. Getting the preventative word out about how these bacteria that are in our heart, for example, endocarditis, which is an infection in the lining of the heart, can be caused by bacteria traveling through the bloodstream from our mouth and then attaching to the heart. And so we are able to get the word out, and then, hopefully we can work with physicians so they can identify potential markers or bad proteins, which let them know that, the patient could have something else going on in their mouth or elsewhere that could affect their heart.
You mentioned earlier the number of people who go to the dentist, and I think in some ways some of us have thought of going to the dentist as something that we did while we were growing up and our parents made us do it, and it was usually every 6 months or a year, depending on what the parent wanted to do or what they felt they could afford to do. But maybe as we become adults, we slack off on that sort of thing, or if we go, it's a matter of a personal discipline or maybe something that was inculcated in us by our parents. This is what we do, and so this is probably what you should continue doing, and we pick up on that and we do it. In terms of practices, generally speaking, if not your own directly, how often do you run into people who either don't go because they fell out of the habit when they left the nest, or they think it's too expensive, or they are afraid of dentistry because they don't recognize that maybe the procedures that were used when they were growing up are quite different now because the technology and the techniques and the training such as you've had are better for many things than what they remember having faced when they were younger?
Yeah, and it's a big change we found because, a couple of generations ago, there were much less technology, and so our grandparents, or certainly our great-grandparents, but, even my grandparents when they were alive, were missing most of their teeth because when they were younger, it was, hey, if the tooth even looks kind of bad, it's coming out, or we'd put a big silver filling in it, or we'd get a denture or something else. And now there's so many more options, and with increasing life expectancies and people keeping their teeth longer and, more photos and selfies being taken, we're all more aware of the appearance of our teeth and our smile. And what we're finding is that, a lot of there was a study the American Dental Association did about, who intended to see a dentist this year, because you mentioned, maybe if we slack off sometimes. And it was, somewhere around 3/4 of people said they intended to see a dentist this year, but out of those 3/4 who said they intended to, about half of them actually did. So the study kind of led us to looking at saying, as I read through it, that the perceived need isn't always there, because if nothing's hurting, nothing's bothering us, we may know we have some old dental work to be replaced or some teeth that need repair, but nothing's really bothering us. We don't really get too excited about going to the dentist, and a lot of people are fearful. It's where, we use a lot of dental sedation to help our patients overcome their fear. But, fear and lack of perceived need are a big reason why a lot of people don't go to the dentist. And, in adults, about half of us will have gum disease. And when you get into seniors, about 70% of seniors 65 and up have some form of gum disease. So as we age, that risk goes up as we keep our teeth longer. And so it becomes exponentially more important. And so, there are 5 or 6 things we have our patients do besides brushing and flossing, but one of those is seeing the dentist more frequently. So me, for example, I have a family history of gum disease and bone loss, and even though I've never been diagnosed with gum disease, I still have a checkup and cleaning every 3 months, and we advise the same for many of our adult patients, that every 3 months or every 4 months is a better fit for a lot of people rather than every 6, to keep up on the maintenance and prevent root canals or tooth loss that can be avoided.
As far as the link between heart disease and the health of your mouth is concerned, then, is that something that you would be inclined to ask your patients about, especially when you are developing a new relationship with a patient, to kind of go through their family history and maybe try to ascertain if they've got potential for something like that you should be aware of, so that your overall level of care for them can be more complete?
Yeah, absolutely. I mean, and we know that, adults in their 30s and up, half of them will have some form of gum disease. So, we see so many patients with these conditions that our eyes really tuned in for it. But we go through things like, diabetes and high blood pressure, and cancer and sleep apnea, and those are some of the major ones that really increase the risk for gum disease, which then can, feed back into those other medical conditions. So it can kind of be a cycle that we can interrupt with, getting people early preventative dental treatment, and hopefully helping break that cycle so that people have more options and, know what's going on, and they're informed on what they can do on their own to prevent tooth loss and, worse yet, other medical conditions that can become time-consuming or expensive or debilitating.
And, of course, what we eat and drink oftentimes doesn't help, especially with the kind of lifestyle many of us lead. We don't always have, or more likely take, the opportunity to clean our teeth properly more than once or twice a day. Yeah,
absolutely. And when our gums recede, the parts of our teeth that are exposed, they're much softer and much more porous, the roots of our teeth, so they don't brush off as easily as our enamel does. And so, a couple of years ago in the U.S., 51% of calories were consumed in the form of liquids. And I don't know if that's still the same today, but I know it's still very high with all the energy drinks, and soft drinks, and corn syrup, and preservatives. And so that's pretty alarming, because with the liquid form, it can be consumed much faster. It's very sticky, it sticks to our teeth, it sticks in those hard-to-reach places, and it accelerates, bad breath, tooth loss, and gum disease.
Thank you very much, Dr. Tyler Williams, for spending some of your time at this hour of the day to speak with me.
Yeah, absolutely. My pleasure.
Thank you very much. Have a good evening, sir. Thank you. Bye-bye.
You too. Thank you.
This concludes this two-part series with Dr. Tyler Williams, a dentist, about why February is important to dentists during Heart Month. For further information, call us at 860-346-1049. The opinions expressed are those of the participants, not necessarily those of the staff or management of the station. I'm Paul Kretschmer on the WIHS Journal, Public Affairs from WIHS, Middletown.